So you're a male and you're wondering if you're at risk of pelvic floor dysfunction. This is the video that is just for you. Stay tuned. Hey, this is Dr. Shakib from Pelvic Floor Therapy right here in Irvine, Orange County. A lot of times, unfortunately, we're seeing more and more younger individuals, younger men, who have pelvic floor dysfunction, and they're wondering why. For one, if you have a sedentary lifestyle, and yes, sedentary lifestyle does not mean after a long day of sitting, you still go and play basketball. That's still sedentary lifestyle because you sat for an extended length of time without really moving that much. Or you don't work out at all during the week, but on the weekends, all you do is working out. So you're referred to as weekend warriors. The issue with that is that during the time that you're sitting on your butt, the pelvic floor muscles, which is your penis, your anus, the space in between, which is perineum, on the inside of your pelvis and on the outside of your pelvis. This is what you're thinking pelvic floor is. That's definitely weakened. Also, pelvic floor is more than that. The sacroiliac joint back here, your lower ab, your lower back, the lower portion of your mid back, and your hips are all influencers and part of your pelvic floor dysfunction. So if you have a slouch, if you stand up in front of your ankles, so when you're standing up, your hips fall in front of your ankles. If you're slouching, if your neck is too far forward, you're automatically at risk for pelvic floor dysfunction. So pelvic floor dysfunction in men can show up as pain in the perineum, pain around the penis, around the anus, pain with after ejaculation, any contraction of those muscles inside your pelvis leading to pain. It can come with constipation and even sometimes pain down the groin area. So if you have some of it, maybe not so intense, and you're embarrassed by it, there is nothing to be embarrassed about. You don't necessarily need to have internal examination of the muscles inside your pelvis to find a relief in that tension there. And frankly, a lot of times it's a constriction and the hypertonicity, the spasm of the muscles inside that are causing a lot of the issues. So the only way to relieve those is not through internal exam and work. And it's not that you get that work done and it should resolve all the problems, because by doing that, you're only addressing a portion of it. So it's one thing to clear an issue, but if the feeders of the issue are still there, you will continue having the issue. So do you have to have the internal exam? It would be probably, depending on the situation, it probably should be factored in, but not so many visits. But more importantly, all the attachments and all the influencers need to be addressed, and your posture needs to be improved upon. So then the whole package, the whole body of yours is being addressed. The muscles are moving in sync. Your agonist antagonist muscles are working together. You're moving properly, and there's no reason for it. Of course, no matter what, you need to limit your amount of sitting, so no more than an hour sitting at any given time. If you need to find out if you're at risk or if you have any of these symptoms and you're wondering what to do next, contact one of the methods of contact in the description box, contact the office, and we will schedule you and see if we can help you. Until next time, take care.